Anton Harman has spent a month on a ventilator in hospital fighting for his life. Despite stabilising, testing negative and his condition improving, he died of COVID-19 complications at the age of 54 on the 21st of May. Jayed-Leigh Paulse sat down with the Harman family and filed this insert.
My name is Tracy Harman. I was married to Anton John Harman. We were married 28 years. We were married on the 3rd of March. And it was just before the coronavirus and we went into lockdown. We have a daughter, Etia. She's 22. She's such a blessing and the most amazing part of our lives. The three of us have done things always together. We've never been apart. My husband was very concerned about catching the coronavirus. When we went into lockdown, we would watch the TV. We would obey all the rules. I'm an essential worker, and he would come and fetch me and we would have our masks on. I would sit in the back of the car. We took all the precautions. He was the only one that went shopping. And people ask you, where did he get it? And I truly don't know. And then got the virus in April. Him and my daughter were tested and he came back positive and she was negative. And then I was tested 2 days after that and I came back positive. And then Department of Health came through to our house because I was an essential worker, and they tested her and her result came back positive then. It was completely devastating. My daughter and my husband had high temperatures, were coughing, had body aches. I had very mild symptoms. I didn't even have a temperature. And we thought everybody would be fine. We isolated together. But as the days grew on, he just got weaker and weaker. And I remember the day before he went into hospital, his temperature was sitting at 39. It just wouldn't break. He went up to the hospital and they admitted him. And it was the last time that I spoke to him. He said he was going into a hike. And later on that afternoon, I got a phone call from the doctor to say they'd placed him on a vent. We weren't allowed to see him. The doctor was amazing. Thank you, Dr. Khan. You phoned me every day and updated me. You answered every single question I had. We would watch the news, we would watch CNN for any signs of a cure, treatment. We tried everything, we really did. He was on the vent for 29 days. Our GP said, no, he's such a fighter, he'll be fine, he'll be strong, he'll come off the vent. And it was the Thursday night, the 21st of May. I would always say to him, love, at 7 o'clock the nurses are going to hand over, you're going to get a new lot of staff and they're going to take care of you. And 7:30 they phoned to say they were busy resuscitating him. Even the doctor phoned about 10 minutes later to say he didn't understand what had happened because he'd had such a good day. They'd bathed him and shaved him. And then they phoned at 8:15 to say he'd gone. You know, people don't realize You cannot even begin to think if you have COVID that you will die. I didn't think that would happen to us. I'm going back to work on the 1st of July. I'm so scared. I have to prepare my daughter now and get my will in order and say, should something happen to me, you need to know what to do. It is tearing families apart. We did everything together. We used to shop together. And yesterday I had to shop and go and get food. I hate going to the shops because all I do is cry. The man that I loved, my soulmate, is not with me anymore. And yesterday we were at the shops and there was a woman there who had a mask on, and she must have had a 3 or 4 year old little girl without a mask. Come on. You know, is your child worth catching this virus and dying? Where are your priorities? The world needs to wake up. They really do. We are not flattening the curve in South Africa. It's just getting worse. I've got colleagues who've got COVID. I've got a family who's got COVID. And everybody is so scared. And everybody is an internet doctor. You know, maybe if this was done, he would have been alive, or if that was done, but it's not. You know, until you get the virus, or you lose somebody, will you understand? I just want people to know that this is not the flu. This is so much more. It's destroying lives.
His passing has really affected the family in so many ways. It honestly feels like we're living in a horror movie or a horrible nightmare and we can't wake up. All we want to do is just to wake up and everything be back to normal. But this new normal is here to stay. My mother has really been struggling, and so have I. My father and I were really, really close. So close, in fact, that I saw him as a best friend. I had the best dad in the world, and it hurts so much. I miss you so much, Daddy. I miss you so much.
Well, our condolences to that family, and thank you for being willing to speak to us at an incredibly difficult time when you are grieving. SABC News reporter Jayed-Leigh Paulse did that story, and she joins me now. I mean, Jayed-Leigh, was this difficult to do as a reporter?
Good evening, Francis, and good evening to the viewers. I think that this possibly was the most difficult interview in my career. Very hard. I think a lot of people, you hear of COVID-19, Francis, but the minute you meet someone who has lost a family member because of the virus, or who is reeling because they know of someone who's lost someone, that's when you actually realize that this is real. We are living this. We are actually living in a pandemic. And it was quite sobering for me. So when I sat down with that family, that's when I realized that this virus is real and we really are living in a very difficult time.
Yeah. Does it highlight for you, I mean, she was saying that many precautions were taken. This was a man who took COVID-19 very seriously. But we're going to look at the increased, the quickening infection rate tonight. So I guess it highlights again, we are all potentially at risk given the infection rates right now.
That is very true. I think it also, puts us all in the reality that the infection rate is increasing daily, and then you have this family member that comes out saying that, you know what, we took all the precautions, we washed our hands, we wore our masks. She even said to me that she doesn't know where he potentially got, infected, and this just shows us that at times we are so oblivious to what we're doing daily. We really need to be cognizant of the fact that we need to practice proper hygiene methods. When you go out, wash your hands, sanitize, make sure that you wear your masks, and also practice social distancing, Francis. I know many viewers are looking at me sitting without a mask right now, and this is purely so that the sign language interpreter and those who are at home can also lip sync and read my lips. But when I am done with this interview, I will wear my mask. I'm sitting in the SABC building. So we need to be very cognizant of what we're doing every single day, no matter who you are, no matter what age you are. She even said there in the interview she couldn't understand why children aren't wearing masks, and this was very important. Why aren't the children wearing masks?
Yeah.
So for parents that are listening to this interview, I think that we really need to heed the call, and like this family, we need to also be very cautious when we go out and we meet people on a daily basis.
I agree. Jayed-Leigh, finally, I think it also shows that COVID-19 hits people so differently, and the course of the disease. We're hearing that some people think they're fine, some people deteriorate, but the disease can actually take twists and turns and drag on. And yeah, it's hard to tell how you will be affected.
Very true. And with Anton Harman, the deceased in the story, apparently he was actually improving a week before he passed on. And this just goes to show that we don't know enough about this virus. And, you know, the medical personnel, the frontline workers are doing all they can, but they too are still learning about something. This is uncharted territory. So really, it's very scary to hear that in the final days up to his passing, he was actually improving. And this just goes to show that we really don't know that much about COVID-19, but we really need to, you know, take the necessary precautions and really take those precautions that government has told us to do, but also the many health workers and frontline workers have told us to do.
All right, thank you very much, SABC reporter Jayed-Leigh Paulse, and again, thank you to that family for being willing to share their story while they are grieving. Now, COVID-19 infections have